Welcome, everyone. Thank you very much for joining this impactful webinar. The session will start pretty much soon. Let's give ourselves some 5 minutes more to wait for the other participants to join, then we kickstart. Thank you very much. Thank you very much for your time. My name is Nane J. Sekapofosumenu, the Communications Officer for Pure Earth Ghana. And today, to mark the World Environment Day, we organizing a webinar to discuss about lead and preeclampsia, the risks in maternal health in Ghana. And with me, we have some experts who will be sharing insights of how these lead and preeclampsia affect maternal health in women in the Ghana context and even across the group. With me, we have Dr. Erica Marquez. She is the Assistant Professor, Department of Environment and Global Health at the University of Nevada, Las Vegas. Dr. Marquez, you can wave them for them to see you. And we have her other colleague, Ian. He is an internal medicine resident at please the name again, Caronian School of Medicine in University of Las Vegas, Nevada, Las Vegas. Thank you very much, Ian. We have the country director for Pure Earth Ghana, Reverend Dr. Esmond Wisdom Kwanzaa, who will also be sharing his insights to us. Reverend Dog. Great. We have Dr. Caesar Nanido. He's toxicology and head of Ghana Poison Control Center at the Ghana Health Service. Dr. Caesar. And also we have Dr. Anita Asamoah. Dr. Anita is a senior research assistant at the Ghana Atomic Energy. Dr. Anita, thank you very much. And we must say, thank you very much all for joining us. We know having such great experts to join us for this webinar is not easy, but we hope after this section, we're going to have a fruitful discussion and create awareness about lead and preeclampsia. Without wasting my time, I think I'm going to give a few minutes for the experts on board to share some brief notes, then we kickstart. I think right beside me, I see Ian. Ian, just a few notes to the audience out there.
Hi, everyone. Like Nana kindly said, Dr. Ian Oker. I'm an internal medicine resident at the UMC Medical Center here in Las Vegas with Kirk Kerkorian School of Medicine. So pleasure to be here with everyone, and I look forward to discussing what we think is a very important topic and hoping to get a good conversation going around it and then see what we can do to move forward to help improve this.
Thank you very much, Ian. Dr. Marquez, a brief note.
Sure. Thank you for having me here today. I'm the director for the Nevada Childhood Lead Poisoning Prevention Program and an assistant professor at the University of Nevada School of Public Health, Department of Environmental Global Health. And this is such an important topic, and we're excited to think about the strategies we can support and employ in low and middle income countries to help support local efforts.
Thank you very much, Dr. Marquez. Dr. Caesar, just a brief remarks.
Yeah, thank you very much, moderator Nanaji. So my name is Caesar Nyadejo. I'm the head of the Poison Control Center here in Ghana. I'm very excited to be in this webinar because I believe it's going to share very important information on the topic, and so I'm very excited to be part of this webinar. Thank you.
Thank you very much, Dr. Caesar. Dr. Anita, quick.
Hello, everyone. My name is Dr. Anita Samoa, a research scientist at Ghana Atomic Energy Commission, and I'm happy to be here for us to discuss, share ideas, and know the way forward to make the earth a better place. Thank you.
Thank you very much, Dr. Anita. And now to our Reverend Doug, the country director of Pure Earth. Doctor.
Thank you very much, Nana. My name is Esmond. Before I proceed, I would like to honor Drew, the president of Pure Earth Global, my supervisor, Gabriel Sanchez, and the comms team, Angela, who has also supported us in carrying this out. World Environment Day offers us a critical opportunity to reflect on the intersection of environmental hazards and human health. In Ghana, rising levels of lead contamination, primarily from informal and substandard used lead acid recycling, industrial waste, and unsafe cookware, pose a grave growing public health threat. And so this collaboration between University of Nevada, Ghana Health Service, and our own, the name just escaped me a bit, Atomic Energy Commission, collaborating on this is very important. We're looking forward to learning from the various experts and also charting forward ways we can collaborate to addressing this. Thank you very much.
Thank you very much, Doug. So this initiative is in collaboration with Pure Earth Ghana, Pure Earth, University of Nevada, Nevada Childhood Lead Poisoning Prevention Program, and Ghana Health Service. Without wasting my time, let's give Dr. Marquez and Ian to start their presentation, and they are going to talk about to increase public and stakeholder awareness, the link between environmental health exposure and preeclampsia in Ghana. Dr. Marquez and Ian, the platform is yours. Please, let's proceed.
Thank you very much. Just getting my presentation up, so just give me a second. Okay. So thank you so much for having us today. We, Dr. Ogarick and I are really excited to be able to be here today to really talk about this intersection between environmental and maternal health amongst an esteemed set of colleagues there in Ghana. And this really intersection is that link between environmental lead exposure and preeclampsia. So what we hope to be kind of the takeaways for today is one is to understand kind of the lead effects of pregnant individuals and their babies. But I think more specifically, it's really understanding that connection between those two and the biological pathways and the current research, which helps us kind of understand how this happens in the body. But also, I think, we're going to do a high level overview, but what's really important is what are the takeaways for us in public health? And how do we then move forward in now our understanding of lead and preeclampsia? And what are the local contexts that we need to employ some strategies? And we'll provide a broader overview, and then some of our colleagues will provide some more specific So why is this conversation needed? And really, it's because lead exposure doesn't affect everyone equally. It's often the most vulnerable communities that are disproportionately burdened when it comes to lead exposure. And when we think about pregnancy, we know that the risk goes up even more. Pregnant individuals are especially sensitive to environmental toxins like lead because of the changes happening in the body and the potential impact on the developing fetus. And again, we also know that if we engage communities and stakeholders, we can begin to think and strategize on strategies such as screening, education, policy, or a combination of those so that we can mitigate the long-term health impacts both to mothers and babies. So what is lead? Lead is a naturally occurring heavy metal, and just because it's naturally occurring, we can't assume that it's safe. We actually know that there is no safe level of lead in the body, especially for children and pregnant women. But I want to think about this also as what is important about lead is context. So context becomes really important because, again, we know that not everyone is equally exposed. And depending on where you live, work, and play, your risk can be much higher. In many low and middle income countries, lead exposure remains a daily reality. For example, informal battery recycling, the open burning of e-waste, small scale mining can lead to lead pollution, which often settles in our communities that we live, work, and play in. Even occupational settings can increase the risk, not just for workers, but also for the families they return home to. We also know there's a growing body of evidence that what we bring home can also impact or be a source of exposure for our families. That could be traditional cosmetics, uses of herbal medicines, lead-glazed ceramics, or even dishware and cookware that we bring home that we use for cooking and storage. So despite what we know about lead is still with us, and the reality is that our communities may be exposed to multiple sources at once. And this is why context matters, and solutions tailored to the environments, occupations, cultural practices become really important, especially during those times of critical development. So why is lead harmful? We know it is persistent in the environment. We know it can be easily absorbed in the body through inhalation, ingestion, and placental transfer. Once it's in the body, it can be distributed to multiple organs in the system. And if through chronic exposure, it can accumulate in the body over time and then affect multiple systems. So what do we know about the impact of lead and maternal fetal health? And we really know that in pregnant individuals is that it's widespread. When lead enters the mother's body, it is stored in the bones and it can be remobilized into the bloodstream during pregnancy. And so once it's in circulation, it can cross the placenta and directly expose the fetus to the toxic effects of lead. So what we know is that lead exposure can result in maternal health effects such as anemia, kidney dysfunction, and what we're going to focus on today is preeclampsia. But this also can have an impact on pregnancy complications, such as miscarriage, preterm birth, placental abruption, or even stillbirth. And we know that another layer of impact on maternal and fetal health is the impact on the fetus and infant. This could include consequences like low birth weight, delayed neurodevelopment, impaired brain and nervous system development. And these reasons are really important because we know that lead is especially a target. The nervous system is a primary target for lead toxicity. And so during pregnancy, that fetal brain and nervous system is rapidly developing. So let's focus now on one of the most concerning maternal complications linked to lead, which is preeclampsia. We'll take a closer look at what it is, how it develops, and how lead exposure contributes to its pathophysiology. So I'll turn it over to Dr. Orgerick.
Thank you, Dr. Marquez. Sorry, I'm just going to get it pulled up here. So as Dr. Marquez had pointed out, there's emerging evidence of the association between lead and preeclampsia. For a while now, it's been recognized that significant lead exposure does have an association or is causative for gestational hypertension, but there's been kind of mixed literature surrounding the true association between preeclampsia. But as we've seen more and more, it really seems like the correlation there is quite strong. And that's what we're gonna keep discussing for the rest of the day. It really is, we want to highlight that the environmental toxicant is a modifiable risk factor for maternal health. So first we should define preeclampsia. So defined as the new onset of hypertension, so systolic blood pressure greater than 140 over a diastolic of 90 after the 20th week of gestation. Typically associated with proteinuria. So measurement by dipstick would be 2+, or if you're doing a 24-hour urine collection, you'd be looking at about 300 milligrams in 24 hours. Or it's the new onset of hypertension with signs of maternal end organ damage. And this can be manifested as thrombocytopenia, which is low platelet levels, impaired liver function, manifesting as transaminitis or coagulopathy, and renal insufficiency, or headache with visual changes that doesn't abate with medication. So one thing it is important to note is you can be diagnosed with preeclampsia even in the absence of proteinuria if there is these symptoms of maternal end organ damage. Globally, preeclampsia complicates about 2 to 8% of pregnancies, but we do see that the incidence is about 7 times higher in low and middle income countries. When we look at Ghana specifically, the prevalence of preeclampsia, the estimate is about 6.5 to 7.3%, and it's actually one of the major causes of maternal and neonatal deaths in Ghana. Next slide, please, Dr. Marquez. So this illustration here is just looking at some of the risk factors and some of the signs and symptoms of preeclampsia to be aware of. So risk factors would include autoimmune disorders, so things like lupus, nulliparity, diabetes, type 1 or type 2, hypertension, Black race, obesity, and low socioeconomic status. Signs and symptoms would be, can be asymptomatic, important to note, but other things we would typically look for is a new onset of edema, swelling of the hands or feet, shortness of breath, and then headache with some type of visual disturbance as well. Next slide, please. So here we just want to give a brief overview of preeclampsia. So we'll briefly discuss the pathophysiology of it. We typically think of preeclampsia to be divided into 2 separate clinical pathologies and entities. First being what we call early onset preeclampsia, and this is defined by occurring less than 34 weeks of gestation. So early onset is really characterized by this abnormal placentation and the incomplete spiral artery formation. And this increases these angiogenic factors such as SFLT1. And this SFLT1 inhibits vascular endothelial growth factor. And this disrupts placental growth and then creates what we call endothelial dysfunction and oxidative stress. And these are some of the entities that we see that causes the end organ damage that we see in the mother. We do see some immunological changes and some genetic components, and we will briefly touch on that in the next slide. The second category we typically think of is late onset preeclampsia, and this is happening after the 34th week of gestation. And this one, as compared to the early onset, where we think of this abnormal placentation, This one, we're thinking of more of the maternal risk factors that are more contributory. So we're thinking of metabolic disease, obesity, diabetes, as well as kind of pre-existing maternal cardiovascular risk factors, such as coming into the pregnancy with hypertension already. We usually see less severe placental pathology in this, and also known associations to point out for this would be parasitic infections like malaria. We typically see present more as a late onset preeclampsia as well. Next slide, please. Here we just have a pretty good illustration, and this is from the American College of Cardiology that gives a good flow diagram of the pathology of preeclampsia. So we'll try not to get lost in the weeds too much with it. But stage 1, we really think of as starting with risk factors already. So these would be your acquired risk factors, as we briefly touched on, such as sleep apnea, increased maternal age, autoimmune diseases, and some of those genetic factors we talked about too, which could be mutations in complement, mutations in a sarcomeric protein called corin, and then some immune risk factors too, where we actually see that there's already a shift towards T helper cell phenotypes, increasing pro-inflammatory cytokines. And then it really leads to this abnormal placentation, which occurs typically in the first trimester before the mother even knows that they're pregnant, where the trophoblast cells invade the spiral arteries and they transform them into low resistance vessels that can adequately perfuse the placenta. But in preeclampsia, we see quite the opposite, which is shallow invasion and incomplete development. And this is where you get that reduced placental blood flow, which we will refer to as ischemia. And this ischemia triggers these large amounts of anti-angiogenic factors, as we touched on earlier, the SFLT1 and SENG. And these really have quite an effect on VEGF and TGF-beta, which are usually critical for maintaining this endothelial integrity. And this leads to this overall state of vasoconstriction and oxidative stress. And that kind of leads us to stage 2, which we consider the maternal syndrome. And that's where the mother who's carrying is having a response to these circulating factors. And again, we're seeing this widespread state of vasoconstriction and oxidative stress. And that manifests clinically as preeclampsia, as we talked about, with proteinuria and organ damage. So to briefly summarize the diagram, preeclampsia begins early on with abnormal placentation. It progresses to endothelial dysfunction. And then while delivery remains really the only definitive cure, understanding this cascade will kind of help us in the future in terms of research and identifying areas where we can hopefully improve outcomes as well. Next slide, please. So now kind of through the weeds there. So the important thing is bridging how preeclampsia is affected by lead. So as we discussed, one of the hallmarks of preeclampsia is endothelial dysfunction, oxidative stress, which we do see with lead toxicity. So multiple systematic reviews, meta-analysis have demonstrated this positive correlation between maternal blood levels and preeclampsia. And there's actually a dose response rate in which it increases non-linearly, especially with blood levels above 4.2 micrograms per deciliter. We know that the faulty spiral artery invasion leads to this intermittent hypoxia and oxidative stress, as we saw in the previous slide. And lead exposure leads to oxidative stress due to this formation of reactive oxygenation species, which inhibits nitric oxide, typically a vasodilator, and promotes this endothelial dysfunction. It's this pathology that's hypothesized to really be the link between lead toxicity and preeclampsia. The exact mechanism hasn't quite been delineated yet, and it is still an ongoing topic of research. But for this reason, once again, it should be highlighted that lead should be a modifiable risk factor for the pregnancy and something we can hopefully intervene on to prevent this. Next slide, please. So we know that there is no safe exposure level, as Dr. Marquez pointed out, particularly harmful during fetal development. So here we just have a diagram illustrating the flow between maternal exposure and then the placental diffusion of the lead, and then the effects on the developing neural system of the fetus. So a couple of things I just wanted to briefly highlight is lead is able to freely cross the placenta And then once in the brain and in the nervous system of the fetus, some of the places that it causes trouble is it can mimic cations such as calcium and interfere with neuronal signaling. It can cause oxidative stress leading to DNA damage and lipid damage and protein damage, which are key during this especially crucial developmental period. And then really we see these long-term cognitive deficits in people who are exposed to lead, such as behavioral difficulties, ADHD, anxiety, and even things such as Alzheimer's. So to kind of conclude this slide, lead exposure, especially during fetal development, triggers complex biological changes with lasting effects. So really should be a public health priority. Next slide, please. Here again, we just have a pretty good picture that's illustrating how lead is actually transported into the maternal blood and into the placental circulation. So lead typically enters the bloodstream via the mechanisms we're going to see below, and reaches the intervillous space, which is a semi-permeable barrier between the maternal and fetal blood, allowing for gas exchange, specifically the syncytiotrophoblasts, or this specialized layer where they typically do cross. It uses a transporter called DMT1, and then it can also use metallothioneins and passive diffusion. Finally, lead typically exploits calcium transport pathway as well. It can mimic calcium, as we talked about on the last slide. Pardon. Once in the fetal circulation, it accumulates in the brain and other organs, and can cause these neurodevelopmental toxicities. Next slide, please. So finally here, we just have some general recommendations in terms of practicality in which we can help reduce lead exposure and the risk during pregnancy. So first, we want to emphasize the importance of maintaining a nutrient-rich diet. So this would include things like calcium, iron, zinc, vitamin C and D. These nutrients are critical because they help reduce the body's absorption, specifically in the gastrointestinal tract. Also, if iron deficiency is present, the mother should work with their physician to help correct that, as low iron can actually increase absorption as well. Supplementation is an option, but we typically would like to see whole food diets be the primary driver here, less so as supplementation, but that is an option. Secondly, we do want to emphasize the education of pregnant women and families on how to identify potential sources of lead exposure. This would include hazards in the home, peeling paint, water systems, industrial dust, or even household items like Dr. Marquez had pointed out, like glazed dishware and imported cosmetics. So by empowering women with both nutritional guidance and environmental awareness, we can equip them to take control of their health and also help protect their developing babies as well. So thank you for your time, and I will pass it back over to Dr. Marquez.
Thank you. So really trying to bring this full circle, what are the kind of the big takeaways in terms of public health actions? And I think to think about this on kind of a continuum between primary, secondary, and tertiary levels of intervention are really important. You know, our first focus is always going to be to prevent exposure, as we've discussed. Lead exposure is preventable. We can reduce the impacts, the long-term impacts of exposure to both maternal and infant health. So thinking about knowing and understanding identifying the built environment, the exposures that exist in that, developing regulations or policies when practical to be able to regulate those sources of exposure. Maternal health education and awareness building is very critical so that people understand what are those take-home or environmental exposures in their direct environment that can pose health risk. We can think about this in terms of secondary prevention, where our focus is early identification and reducing that risk exposure. So how do we incorporate routine blood lead testing or develop risk exposure questionnaires so that we can screen for people at risk for lead exposure. Or thinking about this again from an integrated care model in which we train physicians to identify or screen for these environmental risks in prenatal care. Again, we can think about this in terms of our tertiary level of care intervention, where we're looking at timely treatments, making sure there's postpartum follow-up, and developing developmental monitoring of infants after birth. And I think cross-cutting across all of these different strategies, right? We would employ all at some capacity, but is to build capacity building on a local level, to begin to think about how do we strengthen policies and systems to really bring some of these approaches to the forefront. So we thank you guys so much for your time. And I know we went a little bit over, so we will hand this back over to Nana. Thank you.
Thank you very much, Dr. Marquez and Ian. That was very, very informative. And I hope that all the panelists are really taking down some notes, because after that, there will be some questions and answers that we have to grill the experts to deliver some answers based on the questions we're going to ask. Without wasting my time, let's move to Dr. Anita to also give her presentation. And Dr. Anita, please, the time 15 minutes to quickly do that. Thank you very much.
Hello. Can you hear me?
Yes.
Okay. My name is Anita Asamoah, and I'm a research scientist at Ghana Atomic Energy Commission. And today I'm here to talk about levels of heavy metals detected in the breast milk of Ghanaian women and their implications for maternal and child health. That's going to be the outline of my presentation. Breast milk, as we all know, continues to be the best source of nutrition for infants. And because of that, anything that tends to make it unwholesome is a worry. And this presentation seeks to create awareness of how heavy metals are now found in breast milk. So they are not only in the environment, they are in the human body as well, and the dangers they pose to both mothers and infants. Heavy metals are metallic elements with high atomic weights and densities, and are noted to be toxic, even at low concentrations. Some common ones among them are lead, mercury, cadmium, arsenic, aluminum, among others. How are heavy metals released into the environment? Ghana is a mining country, both small-scale mining and industrial mining. In the process of mining, when the earth is opened up, some toxic metals are released into the environment. Our landfill sites are also a major route to these heavy metals getting into the environment. Recycling, be it electronic waste or lead acid battery recycle, are also major forms of release of heavy metals into the environment. Industrial activities, And also in agriculture, in fertilizer and pesticide applications, we do release these metals into the environment. How do they get? Can we find these heavy metals in human body or fluids? Yes, research has shown that they are in our bodies, and they get in through ingestion, inhalation, absorption into the bloodstream, maternal bloodstream, transfer across the mammary gland into the breast milk, and lipid soluble metals such as mercury can accumulate more easily. Is there evidence of heavy metals in breast milk of some Ghanaian women? Yes. Work done by some researchers have revealed that there are worrying concentrations of heavy metals in some Ghanaian women. Coca et al. In 2011 did some work in Accra and Tema, which is the Greater Accra region, and recorded lead concentrations between a range of 0.045 cis and 5.224 microgram per liter in Accra and Tema. Also, another work was conducted by Branton et al. At Manya Krobo district, which is the eastern part of Ghana. Also recorded a concentration between non-detected to 32.0 microgram per liter. And also in Pando, which is another region in Ghana, Pando, Hohoi, Saudai, which is the Volta region of Ghana. Also, a work done by Coca et al. Revealed 0.022 to 0.032 microgram per liter of lead in human breast milk. Also in Takwa and Obuasi, which are mining communities in Ghana. Banza et al. In 2017 recorded lead concentrations as high as between 5.30 and 117.2 nanogram per gram in the breast milk of mothers. In Manya Krobo district, another heavy metal like cadmium was recorded in the breast milk of mothers. That's a work done by Quantin et Ado et al. In 2010. A range of between non-detected to 12.301 and 0.60 to 6.30 microgram per kilogram, sorry. Another work done in Accra, also on cadmium by Coca, also gave a range of cadmium between 0.0085 and 0.500, and also in Tema, 0.0122 and 0.0644. Arsenic concentration at Takwa, a mining area in Ghana, was also very high, in a range of 7.0 to 120.4 microgram per gram. Also for Manya Krobo district, a range of between non-detected to 6.22, and mercury is also recorded in Takwa or in Obuasi, also a mining area, between the range of 1.36 and 63.52 nanogram per gram. So as we can see from the data in Ghana, about 3 or 4 regions that we have discussed, the mining areas have higher concentrations of lead, arsenic, and other toxic metals, which is a worry, and most of them are beyond the WHO accepted limits. Is there a need to worry? Definitely. The previous speaker said a lot on the effects of some of these metals. The babies we are giving nourishment, we may not be giving them only nourishment, but maybe some doses of poison, which can reduce their IQ and cause behavioral disorders, something like lead, interfere with calcium and iron absorption. They will mimic essential micronutrients, and they will rather be taken rather than the micronutrients. Breast milk can contain lead even when maternal levels are moderate. Mercury also affects brain development. And since breast milk is given to babies who are still developing, anything that is detrimental to their health or brain development is a cause of worry. Methyl mercury from fish is particularly dangerous. So some of these metals get into our water bodies and our food and get into the food chain. And once the pregnant woman takes on and during the mobilization to form milk and breastfeeding, this mercury can be transferred to the baby, which is also poisonous. And some of these chemicals can also accumulate in the infant. Cadmium can result in kidney and liver dysfunctioning, which is also a worry. Reduced absorption of zinc and iron accumulates over time. Arsenic is carcinogenic, and endocrine system causes a problem with the endocrine system. Arsenic is being found in water, rice, and other things, which is also a cause of worry because in Ghana, most Ghanaians rely or rice is a delicacy. Aluminium is linked with neurodevelopmental issues, common in some infants' formulas, food in cookware, and some medications, especially the herbal one. Why worry about lead and mercury contamination? As we have already talked about the effects, we are not just talking. There's evidence in our dailies, news headlines showing that we have these contaminants in our environment, be it lead, mercury, or others, and they are very harmful, which can result in death, low IQs, destruction of our vegetation, organ diseases, and other forms, which we cannot compromise. What can we do to protect our infants, ourselves and our infants? There is the need for continual monitoring in different matrices or media in different parts of Ghana to be sure that the environment is safe, we are okay, or the citizenry is protected. And where we find challenges, we come in quickly to help. Stakeholder engagement is very key. Public education, as we are doing, is also key to let people know what is happening around them, how they can protect themselves, and what they should do, even when they happen to be in areas of mining or recycling areas, and many more. Training of industrial workers or e-waste recycling or lead lead acid battery relapse, ULAVs, whether on how to do their work well, so that in their quest to generate money or to take care of themselves, they will not go home with diseases that money can't pay. We need to also be very strong at our borders to screen paint, toys, and other things that are coming into the country. Where there are laws and there are no enforcement, it's better that there isn't even laws at all. I will encourage that laws on heavy metals or mining or industrial waste discharge and others are being enforced so that the right thing is done for the environment to be safe, for mothers to be safe, and us giving healthy breast milk to our babies. Contaminated site investigations are very key. We need to continue to conduct investigations like contaminated sites such as Agbogboshi, landfill sites, and others. And once we see that these places are contaminated, there is a need for remediation. I thank you very much for listening.
Thank you very much, Dr. Anita. That was so great. I hope everyone is also pinning down their questions to ask these experts after the presentations are done. Let's move on to Dr. Caesar Nadijo from Ghana Health Service. Dr. Caesar will be highlighting the best practices and strategies for reducing environmental risks associated with high preeclampsia and lead. Doc, the floor is yours. Thank you very much.
Yeah, thank you, Nanaji, the moderator. Please, is my screen visible? Great, thank you very much. Yeah, great. So, yeah, so my topic is to share some lights on the strategies for reducing environmental risk factors associated with preeclampsia. So the previous speakers, before then, just a quick intro again. So my name is Caesar Nyadejo. My background is toxicology, and I also double up as the head of the Ghana Poison Control Center of the Ghana Health Service. And as I said, my topic is to deal with the strategies for reducing environmental risk factors. So I would move straight into that. The previous speakers, as I mentioned earlier on, have throw light on the environmental contributors, or the drivers to the topic preeclampsia. So they mentioned the elevated blood levels as one of them. I didn't hear clearly whether the malaria infection was also mentioned, but copiously in the literature also is the malaria infection, especially Plasmodium falciparum malaria infection. So I sort of want to quickly start from that. And the strategies for reducing the burden. So I sort of again, it was mentioned in the previous speakers where they mentioned the various strategies from primary, secondary, tertiary prevention, and all of that. But in the our standard treatment guideline, the Ghana standard treatment guideline also, we see this style where it is presented as non-pharmacological, approaches, and then pharmacological approaches where they're available. So I sort of adopted that one also. So for the malaria, fortunately for those of us in Ghana, I think we have very strong programs and interventions going on in malaria, so we are familiar with it. So just a quick recap on them. So community education, to eliminate the insect vector, very important. And then for prevention of mosquito bites, through the use of the insecticide-treated net, have been going on very strongly. And then, regular and frequent antenatal care visits for counseling and screening, has to go on, for malaria as well, so that it's well taken care of. In terms of the pharmacological approaches, to malaria again, we're very much familiar with that in Ghana, including, the chemoprophylaxis, and which includes the intermittent preventive treatment of malaria in pregnancy, the IPTP strategy, using the appropriate or the designated medications at their correct doses, and so on and so forth. Then improve prenatal care, to monitor malaria infection, and then appropriate management or pharmacological management using appropriate medications and the right doses. Yeah. So I'll move on to the lead, which we've heard this afternoon as one of the other new, probably the other new driver, environmental driver, contributing to the discussion on the topic, the preeclampsia. So as part of the strategies for reducing lead exposure, a key aspect is identification of the source or the sources of exposure. So that has to go on because if the exposure levels are detected to be high, and we haven't identified the source of exposure, and we're managing, we're just managing, and the exposure keeps continuing, and we sort of, so very important to identify the sources. And I think the previous speakers have mentioned the sources of lead exposure, where we get it from, so we are able to inhale it, and so usually through inhalation and ingestion, inhalation from the air, if it's the air from the various sources that has been mentioned, the lead acid recycling activities, industrial emissions, and all of that in the air are monitored, the concentrations are enough to cause the effect they will cause it. And then in the various products, as you mentioned, so identification of the sources, and then termination of the exposure. And then education, and awareness creation has to go on, among the public, including, the target group that we're talking about, the pregnant women, screening, the blood lead level screening among the pregnant women. And then, once the elevated levels are found, then we get down on how we work on that. Promotion of, lead-free environments, it's a key aspect that has to go on. So yes, the thresholds level at which, lead is known to cause all this toxicity are well known, including the levels at which it causes, elevated blood pressure, are all well known, and that's why we have to work towards those targets to make sure the levels that are in pregnant women are far below those threshold toxicity levels. Yeah, the other aspects of reducing exposure will include strengthening regulatory frameworks, I think mentioned in Dr. Anita's presentation. So in Ghana, for instance, I'm aware of these two standards, the ambient air quality standards, as far as lead is concerned, and that in paints. There's also that standard developed by the Ghana Standards Authority together with the other key stakeholders, environmental protection, and so on and so forth. So we need to make sure these things are being monitored so that, that levels are under control. Otherwise, they will get to the population. Yeah, the previous speakers mentioned this point as well. So calcium ion and vitamin D are known to increase lead absorption. Are known to reduce lead absorption. So we have to make sure that the pregnant mothers, because the lead, together with all this, I think competitively compete for the sites, for binding, as far as the binding to the relevant sites, are concerned. So we need to make sure that these micronutrients, iron, calcium, and vitamin D are well supplemented in the pregnant women, and then that will reduce their absorption of lead if it's in the blood as well. And then the pharmacological approaches. So fortunately for lead, there are known medications that are known to reduce the level of lead exposure in the blood. So the chelators will sort of bind the lead and then remove them through the physics, is the main route. I think a little bit also through the urine. So we have to work hard to make sure that these chelators are available, so that when the elevated levels are found, the pregnant women can have access to them in a timely manner to be used and reduce their body burden. Yeah, so the other issues include, the other monitorings that have been talked about, blood pressure monitoring, the urine monitoring, as you go on. As a way of summary to my section, so yes, early detection or lead poisoning remains a significant public health problem, and its impacts are known in various populations, including the pregnant women, and that early detection and prevention are crucial as they cause harmful effects even at very low levels. So education awareness creation very important, including the creation of the awareness to the pregnant women, and and research. There's a need for continual research, to understand the full impact of these environmental drivers, the lead, or the other few of the other heavy metals have been mentioned in affecting the or being as impacting the cause of the preeclampsia, and the research have to continue until we unravel all the potential agents that are involved. We are able to come up with appropriate intervention appropriately. And the research has to be local and global. So thank God, there's this collaboration going on between, the Ghana Health Service, Pure Earth, and the University of Nevada, and we're hoping that, moving forward, we are able to get the supports that are needed so we can drive more of the, interventions and the specific research studies that have been planned forward. Thank you.
Thank you very much, Dr. Caesar, for this presentation. In fact, there are so many questions coming up. I want Reverend Doc to also finish his presentation, then we read the questions to you all for you to answer that. Reverend Dr. Esmond Kwanzaa is the country director for Pure Earth Ghana. He is giving a presentation to promote interdisciplinary dialogue on preventive strategies, policies, and public health intervention addressing maternal exposure to environmental toxins. Please, Reverend Doug, the floor is yours. Thank you very much.
Thank you very much, Nana J, for the wonderful introduction. So my name is Esmond Kwanzaa, the country director for Pure Earth. I would largely be summarizing what all the 4 speakers presented. because the topics intertwine. Okay, so as the rest of the speakers, Dr. Anita and Dr. Caesar have mentioned, Ghana faces significant environmental challenges as far as the heavy metal pollution is concerned. We're talking about lead and mercury. In terms of lead, we are looking at the informal and unregulated used lead acid battery recycling, which is very pervasive in some parts of Ghana. Illegal artisanal mining, which is popularly called the Galamsey. It's also common across 13 regions out of 16 in Ghana. But usually they use mercury as the most extractive method of refining gold. So it's a huge challenge. Use of contaminated consumer products like cookware and then the eyeliners are some of the ways through which these heavy metals pollute and cause poisoning. This contributes to widespread pollution in our communities. So Pure Earth has been collaborating with our partners in Ghana since 2007 to work towards addressing these challenges. In 2020, Pure Earth and UNICEF Ghana Health Service collaborated together to implement the Protecting Every Child Potential project. And in that project, blood lead level measurement was conducted in 3 ecological zones of Ghana: Greater Accra, Northern Region, and Ashanti Region. The blood lead level measurement survey revealed that 53.5% of 3,227 children tested in these areas have higher blood lead levels, greater than 5 micrograms per deciliter. That is at a level where WHO asks for immediate interventions to be taken. One key thing in that study also revealed that elevated blood lead level appeared to be driven by both industrial sources and consumer products. One thing about this study was restricted to children under 5. And so we did not actually conduct blood lead level measurement in the mothers or the women residing in these areas to determine the levels of blood lead in their system. The study was also backed with home-based assessment. Home-based assessment with the goal to identify sources that are contributing to blood lead levels in the children. And one thing that came out was the use of traditional eyeliner for kids, which is usually called the chilo. This chilo was found to be a very important exposure source. 90% of the women that we survey in Yendi and Tolong in the northern region confirm using the chilo, the eyeliner, on children. In fact, mothers actually also use this on themselves. This is cultural and also traditional. But most of these eyeliners have higher lead levels. Some of them measure as much as 1 million part per million, some as much as 3 million part per million. That is so much. The home-based assessment also revealed that 77% of the cooking pots, which we locally call here the daddy-sang, contains higher lead concentrations above the reference levels. Some of the cookwares contain as much as 26,000 parts per million. The home-based assessment also reveals that the industrial pollution from the used lead acid batteries and the e-waste is also very, very, very big across the study areas. Now, I separated a battery recycling because that's, according to the home-based assessment study, especially in areas in Greater Accra, suburbs in Greater Accra, Kong and Afenya, the informal and substandard lead acid battery recycling appears to be the most source of acute poisoning in the children living in these areas. The lead pollution from these industrial sources was reflected in what we saw in the soil surrounding homes, especially of this around these used lead acid battery recycling industries. Some soil concentration recorded as high as 7,000 parts per million. This is more higher than 20 times higher than the US EPA residential standard of 200 parts per million. And you find children playing in this soil. You see women, pregnant women, living in settlement around these areas where we found this alarming pollution of used lead acid battery activities. So this is really concerning. And the incidence of preeclampsia in these areas seems to be very, very high. That is also concerning. As part of Pure Earth's continuous engagement to identify sources of lead poisoning, Pure Earth undertook a rapid market screening study. Ghana was part of the 25 countries where this study took place. 193 samples were analyzed across 4 regions in Ghana, close to about 10 markets. And what we found actually confirmed the findings of the home-based assessment, that the metallic foodware or the design, the locally fabricated cookware, higher levels of lead concentrations above the reference levels. 55% of the metallic cookware that were assessed actually had recorded higher levels of lead. The ceramic foodware, toys, and cosmetics all recorded significant and higher levels of lead in them. This is really concerning. And so if you look at the lead exposure in maternal health, clearly, as other speakers have also indicated, lead is a potent neurotoxin which easily crosses the placenta barrier, affecting both mother and a fetus. We know also through the toxic through report that elevated blood lead levels may be associated with preeclampsia, miscarriages, low birth weight, and developmental delays in children. If you put all this together, clearly more needs to be done to really understand how these heavy metals interact with preeclampsia. There's a need for interdisciplinary action. And as the previous speakers have clearly articulated, public health professionals need to be very much involved in monitoring and educating the public on these issues. This is why Pure Earth has been collaborating with Ghana Health Service to be able to undertake health surveillance, public education, to be able to address some of these issues that we have identified through the work we've jointly done. Environmental scientists are also part of this important interdisciplinary action to be able to identify and mitigate contamination. Pure Earth since 1999 has been working through 8 toxic identification programs to identify toxic sites and prioritize these sites for remediation. And for Ghana, since 2010, Pure Earth has been working with the authorities to identify and prioritize these sites for remediation. Policymakers like EPA, Environmental Ministry, and Ghana Standards Authority are all supposed to be part of this important interdisciplinary group to regulate and enforce safer practices. Pure Earth has been collaborating with Ghana Environmental Protection Authority to address some of these policy gaps. I know other funders and other organizations through initiatives such as Sustainable Recycling Industries have done a lot to develop standard operating procedures for use-led acid battery industry to adopt and adhere to, but a lot more needs to be done. Pure Earth currently, through the open field regulatory project, we are collaborating with Ghana Standards Authority and EPA to try to identify the gaps in terms of regulation in the consumer product sector to be able to enact policies that would be able to address some of these challenges as far as this is concerned. One key thing that is needed as far as this work is concerned is community mobilization. There's a need to mobilize the local community to be part of this awareness. As part of this measure, Pure Earth is collaborating with EPA, Ghana Health Service, through the funding from Australian government to undertake awareness creation intervention in areas that I mentioned earlier, Hong and Afienya. These are areas we discover that the activities of these recyclers, informal sector, and both even the so-called formal sector, is contributing significantly to lead pollution and blood level in the children under 5. Some key strategies that we could adopt is just address some of them already: education, community education, regulation, and enforcement. I think last week we participated in the launch of one of our projects, and I indicated to the plenary that we are not against sustainable recycling of use-led acid batteries. What we are against is prioritizing profit over sustainable recycling of use-led acid batteries. And so I'm using this medium again to call on the regulators, most of them are partners, to implement stricter enforcement as far as this lead acid recycling is concerned, and also, of course, to formalize the recycling sector. And that is why I'm happy that we are collaborating with Ghana Standards Authority and Environmental Protection Authority to be able to identify some of the gaps and be able to address them. Another key way we can strategy for prevention will be environmental remediation. Pure Earth has been collaborating with our partners to undertake cleanup for the sites that we've identified through the toxic site identification program. And I think recently we've supported Swame District Assembly to conduct a cleanup of one of 8 toxic sites in Swame. We've also supported some of our partners to undertake some cleanup in the Greater Accra region. So these are all ways that we could ensure that we stop the multi-generational recycling of lead pollution and poisoning going forward. Health system interventions is also key. Incorporating blood level screening into antenatal care is, I think, one of the best ways we can strategies to be able to prevent this issue. Conducting ongoing surveillance of environmental contamination and maternal blood levels. It's very, very important. Pure Earth is working with partners and funders to be able to come up with strategies that we can support Ghana Health Service and its agencies in some of these areas. So we're still calling on all our partners and our funders to collaborate with Pure Earth, join hands with our partners to be able to address this issue that is so much of a huge issue. So Pure Earth's role, someone who asked, what is Pure Earth's role in this at all? So Pure Earth, as I've mentioned briefly in bits and pieces, Pure Earth is involved in identifying hotspot of heavy metal contamination through its toxic site identification program. And through our home-based assessment program, we also conduct environmental assessment to identify sources, then also implement remediation projects, where we notice hotspots of concentrated or polluted site. Pure Earth collaborate with the community to undertake this exercise. Conducting outreaches to raise awareness is very key. It's something we are doing actively now in Ghana with the collaboration of our partners and our funders. And also POED has been building capacities for local government in pollution control and public health response in Ghana for some time now. And this is something we are happy to continue doing with our partners. POED has a 5-phase approach to solving lead poisoning. And this is something I would really like to articulate for us to be able to make gains and significant progress in this area. There will be need to intensify this across the country. And one of the key phases, one of the first phases is the health surveillance, conducting blood lead testing across the country. If you listen to Dr. Anita sharing the result of various heavy metal testing, blood testing across the country, there seems to be higher levels of heavy metals in the blood across the country. So there's a need for a nationwide prioritization of health surveillance to be able to address this going forward. The second pillar is source assessment. So identifying key exposure sources, which we do through environmental assessment, home-based assessment studies, and then source-specific interventions, which target specific lead sources. So this is where we actually design programs like remediation, community awareness, and all that to be able to address the issues that we identify through the source assessment and then health surveillance. And then awareness and education conduct based on what we identify from our interventions and all that. We are able to work with the community, develop communications to let them know about the situation, and then of course work with them, the community, to be able to address some of the issues through campaigns. Institutional framework, this is where we work with the government to be able to address the issues that we've identified. And POED has been doing quite some work in that area. We've done some work, I'll mention that briefly, but as part of the policy and collaboration opportunities, we need to strengthen regulatory frameworks. Multi-sector collaboration is very key, and that's why we in POED are very happy to be collaborating with University of Nevada, far away in the US, to be able to support us in a way that we can address some of these issues. Community engagement and data-driven policies, using evidence to inform interventions and monitor progress is one key policy interventions that will be required to be able to address this. As part of the work we do, one of the successes in the past years was the National Declaration and Action Plan against lead poisoning. This was based on the work we've done with our collaborators, UNICEF, Ghana Health Service, and the ministry, Ghana Environmental Protection Authority. We also have a Ghana Standards Authority through Dr. Kobe. We're all involved in this process to come up with a national action plan to address lead poisoning. So these are some of the ways that we believe we can work together to address some of these issues as far as lead pollution and poisoning is concerned. For key steps moving forward, we need to continue what we're doing. This webinar, for example, is an example. We need interdisciplinary dialogue through workshops and joint projects, as we are seeking to do with our partners, to continue highlighting this issue and addressing it. Integrating environmental health into maternal health programming is very key. I think Dr. Anita and then Dr. Marquez, also Dr. Caesar mentioned this, is very, very key. And also to develop policy that address the root causes of this lead pollution. And that's very, very key, strengthening policies and regulations, and then stricter ones to be able to ensure these issues are addressed. And then finally, investing in community-based interventions and local capacity building for sustainability of some of these interventions that we are implementing. So thank you very much for listening.
Thank you very much, Reverend, for the detailed presentation shared with our stakeholders concerning the work that POED does and how to solve some of this pollution. There are so many questions in. I'm going to read some questions. I'm seeing Lauricia at the back door giving me a lot of questions to read. So there are so many questions in. I'm going to read some questions that have come in, and you other people can also share the questions and what is bothering you direct the question to anyone and let them answer to your satisfaction. There was a question in the person asked, is there any routine or periodic monitoring being conducted in the industry to ensure that the air and water quality is under control for lead and other heavy metals? Beyond industry, is there any other biomonitoring being conducted to potentially map high-risk areas and potential body burdens in these areas?
Okay, so I think I'll try and take part of that. So I know that the EPA has monitors, but I know there are limited monitors at a few places in the country where they monitor the air levels of some of these environmental pollutants, including lead. Yeah, so EPA does that, but in limited locations as far as air emissions are concerned. So I think there'll be a need for a more comprehensive program on all those monitoring, on all those monitoring. As far as the other matrices, soil and water are concerned, I'm not aware of specific monitoring going on. I'm not aware of any specific monitoring going on. Thank you.
Thank you.
So add
Dr.
up
McQuest.
to
Okay. Dr. Anita, please go on.
To add up to what Dr. Caesar said, I know that EPA require companies to submit their environmental management plan, which they submit results of their testing, that is their effluent discharge and others, which I know their mines do that a lot. So I think that is also being done. So maybe we should be more rigid in enforcing that these are done. Yeah.
All right. Dr. McQuest, do you have any question, any answer to that, or it's okay?
No, I don't think I have anything else to add.
Okay. Reverend?
Yeah, I think next time we should bring EPA here. Yeah. So I think what I know is through the UNICEF Healthy Child, Healthy Environment Project, UNICEF is sponsoring Ghana Environmental Authority to undertake some limited air monitoring around part of Greater Accra. So Dr. Caesar is very right, that is ongoing. They also do specific areas across the country, but it's not a nationwide. I think Madam Salina, that's her department. She's the one who had that department, the air monitoring department. So they are doing a bit of work across the country, but not, I don't think you have the entire coverage, but they have selected areas they do the air monitoring. I know of Greater Accra, different areas they do the air monitoring as well.
All right. There is another question that what is the potential side effect of the deciliter treatment? What is the threshold that is considered?
Okay, thank you, Nanaji. I think I'll take that as well. So, so the chelation therapy is indicated and initiated based on the blood level, 2, the clinical signs and symptoms, and then after confirmation that there is absence of ongoing lead exposure, so that's when then, if there's still ongoing exposure and you are still doing your chelation, we sort of just going through the cycle. So the chelation therapy is indicated and initiated, based on the blood lead levels, the clinical signs and symptoms, and then making sure that there's no more ongoing exposure. So as far as the blood lead level is concerned, so for Ghana, we have adopted the WHO threshold, which is the WHO threshold is 5 micrograms per DL. And once we find levels of blood of lead in the blood up to 5 micrograms per DL, it is then considered elevated. But at that point, a number of actions are needed, including identifying the sources of exposure and all of that, but not chelation therapy. Chelation therapy actually would kick in when blood levels are 45 microgram or higher. So from 45 microgram or higher, or when there are signs and symptoms of severe lead exposures, such as lead encephalopathy, and so on and so forth, then there's a need to do the chelation therapy. Now, as part of the recognition of the heavy metal emerging exposure and all the AIDS problems and all of that, the Ghana Health Service, we've been working with the Ministry of Health, and we've developed standard treatment guidelines on the topic. What needs to be done now, it's a lot of awareness on the standard treatment guidelines to clinicians across the country, so they are aware of the guidelines and all of that. And then in the guidelines, for instance, you use the chelators. There are those you use when they are mild and moderate, and those you use when they are very severe. So for mild and moderate, for instance, we have a first line, second line. The first line, for instance, is in the Saxima, and then the second line, is in the calcium edited and all of that with their dosing. So I don't know whether this platform is the best way to get into all the details of the dosing and all of that, but all those informations are available in the new treatment guidelines that have been developed, within the health sector. Thank you.
Thank you very much, Dr. Caesar. Dr. Marquez, there's a question for you, directed to you. Considering the emerging evidence of lead exposure and preeclampsia in low-resource settings such as Ghana, are there opportunities for prospective PhD students to collaborate with Pure Earth or through your work at the University of Nevada to further explore this, perhaps through applied research, joint field work, or academic supervision? I'm particularly interested in investigating exposure pathway and implication for antenatal care policies in Ghana or other areas of mutual interest.
Yeah, thank you for the question. And absolutely. And I think Dr. Kwanzaa has been, we've developed a great relationship in developing and figuring out what are the things that we can work on together and support some of the local efforts. We do have Lorenza Bansu, who is a current PhD student, and I would like to acknowledge for all her work working with Nana to get this webinar together. But she's also already starting to work with Pure Earth Ghana to look at different water quality issues that may be happening and doing some testing. So we're already planning in the next coming months to go and do some field work in looking at not just lead as a heavy metal, but also various heavy metals and water quality issues that could happen in some of the boreholes in some of the mining communities, and looking at other control sites to do a comparison. But we think that this is the beginning of a long-term relationship in which we can funnel PhD students at the University of Nevada to help support local efforts and continued research in preeclampsia and a variety of local efforts that that you guys are already working on, because that is what is important to us, to make sure that we support what is important and what is going to be translational, not only in research, but also in policy and developing those types of contexts.
Thank you very much. There's a question here. I'll throw it all the panel speakers. If cooking pot contains levels of lead above reference levels, what are the recommended pots for use? Are there recommended versions affordable to the most affected families? How do we regulate the importation of local manufacturers of such pots?
All right, Nana, thank you very much. So Pure Earth has been doing some work in that area with our partners, Ghana Standards Authority and EPA. I don't want to jump the gun, but Pure Earth at the moment, it's supporting Ghana Standard Authority to come up with standards to address the lead concentration in the locally manufactured cookware. as we know, 90% of Ghanaian homes actually use the contaminated, the locally manufactured cookware, which some of them are found to have higher levels of lead. So we're hoping that in the next 6 months, we would have a detailed regulation that would address the issue of higher levels of lead in the cookware. In terms of what probably would be the best, and of course, aside this, the open field project, a regulatory project, is also working to undertake supply chain analysis of the manufacturers and then the key stakeholders involved in the process, just to build a database of these local artisans and provide support for them going forward. I think the logical next step with the Ghana Standards Authority would be the certification process for the local manufacturers, and Pure Earth will be working with our partners to ensure that we're able to get to that. In the meantime, if anyone would probably want an alternative, the alternative would probably be the what do you call it? The alternative would be, am I still on? Okay, I froze a bit. The alternative would be the stainless steel, which also comes with a cost. But that will probably be an alternative. But of course, Pure Earth will be working with the various government agencies to be able to address the cookware issue, which probably may not be exactly now, but we're hoping that we can be able to work with these regulators, our partners, to be able to address this holistically in the coming years.
All right, thank you very much. Anyone with any question can also raise their hand, and Lauricia will do the needful to make the person also speak. There is a question to, they are asking, if a pregnant woman or a nursing mother discovers that she has been exposed, what will be the possible line of action if her exposure is occupational?
I can help out with this one a little bit. So if the pregnant mother feels or is concerned that she has been exposed, first step would be to reach out to like local public health department or their physician, whether that be their obstetrician or whether that be their primary care physician, and they can have their blood level checked. Typically, this is either venous or capillary, to get an idea of what their current level is, if they've truly been exposed, as Dr. Caesar was talking about. There's the different levels that we do become concerned with. And then typically you want to confirm that testing as well. If it's an environmental exposure, that is a pretty tough one. Typically the recommendation would be you would want to be pulled out of that environment if you are getting a substantial exposure from there. Because as Dr. Caesar mentioned, if it was such a substantial exposure that you were going to require therapy, the therapy can actually be of detriment if you have continued exposure to lead in that scenario, because it actually can increase the uptake of it. So it is a pretty difficult one in terms of if their exposure is their place of work, but the recommendation would be to kind of work with their local public health authority and toxicologists such as Dr. Caesar, and see what can be done, and an ideal situation be removed from the exposure and get their blood level drawn and to determine what the actual level is.
All right, thank you very much. Let me pick the last question, but you can send all your questions via email. We are going to get you in touch with all the answers you want. I've seen so many questions here, but unfortunately our time is running and we have to end it. But let me give this question directly to Dr. Marquez. They are asking, will the research at the University of Nevada consider a twinning principle that allows for their students to pair with a resident doctor at the postgraduate medical college and support their research together?
Oh, that's a great question. And we're open to all and any opportunities. So please reach out to us after today's meeting. And it's definitely something that we are working on, setting up great partner relationships for our students that can provide local support.
Thank you very much, Dr. Marquez. I can see Dr. Maxwell Kodbe's hands up. Lauricia, can you please allow him to talk?
Good morning, everyone.
Good
Am
morning.
I audible?
Yes, please, Dr. Kodbe.
Yeah, I'm in Ghana, work with the Ghana Standards Authority. Here, we've made some strikes with support from POF, Ghana Health Service, and also EPA. But sometimes we consider it not to be enough because we believe that there's a lot that needs to be done. So my request to our professors in Nevada is, can you share with us some successful implementation countries, strategies, where they have been very successful with these lead issues? Because sometimes I feel it's a bit new to the whole world, and Ghana, we find ourselves in this mess. So if you can share with us any successful strategies that perhaps you could propose to us such that we can adapt and make further strikes. Thank you very much.
Thank you very much, Dr. Kodbe. So, Dr. McQuay.
Sure. So yeah, I think there are some successful strategies, but I think they have to be developed in context, right? And I think we've covered amongst all of the speakers that there are a variety of prevention strategies, whether it's primary, secondary, or tertiary, that we can employ. And I think it's going to depend on understanding local capacity, resources, and what we can strategically implement as we work towards, what we think is, a good standard of care. And we're happy to have more discussions offline about this, and obviously work with local partners to kind of think about what are those strategies.
Thank you very much, Dr. McQuay. We thank you all for joining. I think it's time to bring the event to a close. I want to say thank you very much for spending almost about 2 hours with us for this insightful discussion. And we hope we receive more of your questions. We are going to address it. One, Lauricia is behind getting all the questions. He's going to address it and also share with everyone who requested for the PowerPoint presentation for more education and awareness at your end. At this time, I think I will say a big thank you to Lauricia too for helping in organizing this webinar at the University of Nevada, and also PureEd for also making this possible, to bringing it to the doorstep at everyone. I want to say thank you to everyone. Let's call on Lauricia to give the closing remarks, and we call it a close for the day. Thank you very much. Lauricia, over to you. Lauricia, are you there? Well, it seems maybe she's having quite difficulties in. Lauricia, are you there?
Yeah, can you hear me?
Yeah, we can hear you.
Great. I'm sorry, my yes, so thank you everybody for being here today. We had so much fun. We learned so many things, and we hope that this collaboration will continue to go on, and we will have great conversations concerning heavy metal pollution, and in future help to reduce the pollution in Ghana that we are facing. And thank you everybody for being here today. Please, we put our website in the chat. Feel free to send us an email. Feel free to send us a chat and then visit our website, and we would love to answer all your questions. All the PowerPoint presentations from the presenters will also be shared. And please feel free to send anything that you would want to know. And we are also open to collaborations. And adapting to new environments. Thank you very much, everybody, for being here today.
Thank you very much, Lauricia. And also don't forget to visit our website on www.pureearth.org and you get more information about heavy metals, lead and mercury and other information that you need. This webinar is recorded and it will be on our YouTube page and also blast on all social media platforms. So if you want to recap, watch again, you visit PureEarth YouTube page or visit PureEarth social media platforms. The link will be shared for you to also go watch again. I want to say thank you to all the panel speakers for making time to sharing their insights, and we are very grateful. And I hope this section has been very educative to us all. Let's meet next time to create the awareness about environmental toxic pollution. I will say bye-bye to you all.
Thank you. Bye.